Hello there and welcome back to Dr. Z's Health Education Videos. This is Dr. Zaidi here, and in this video I'm going to talk some more about AMD, or age-related macular degeneration. Now some of you have asked, well, I like your drawings and I like your explanations, but show me actual pictures of what this disease looks like. So that's what I'm going to try to do in this video. Now again, going back to our top diagram here, if light is entering the front of the eye, passing through the cornea, passing through the lens, and then it lands here on the retina. If I were to circle this portion of the retina, this would be called the macula. That's the center of the retina. Now let's suppose I were to take a picture of the macula. If I were to put a camera right in the front of the eye and focus just on the macula and take a picture, here's what I would see. So let's label some of these things that we see. So on the left here, we have a normal looking macula. So we'll call this normal. Optic nerve, these are the arteries and the veins. And then this portion here, if you really wanted to focus, is the center of the macula. So we'll call this the center of macula. And here is where we have our most light-sensitive retinal cells called the cones, and these cells are responsible for our sharp central vision. These cells in this area in the circle are responsible for our ability to read, to see a person's face, to watch television, to do all of the functions that we're used to, sort of our center vision. So if we have on the left side normal, let's look at a patient with dry AMD. So this is a patient with dry macular degeneration. Again, you see the optic nerve looks the same. Ignore the fact that this picture is more orange and this picture is more yellow. That's just the nature of how the photograph was taken. What you should notice is that the optic nerves in both patients look to be healthy, but the area in question that looks suspiciously different is this central area. Again, the center of the macula looks different. If you look at this person's eye on the right versus this person's eye on the left, you see that there are these yellow deposits, these yellow pebbles, so to speak, these yellow stones deposited in the retina, and these are called drusen. Drusen. These are little stones or deposits of material underneath the retina. As you can see, this patient here has lots of little yellow soft-looking drusen deposited in the retina. And as we've talked about in our other video, these drusen are material, waste product, so to speak, that has been deposited in this retina and accumulated over years and years. And these drusen can cause distortion and blurriness in the vision. Okay, so now I've switched this image here, and I'm going to show you a picture of a patient that has more advanced dry AMD. So we'll call this advanced dry AMD, or macular degeneration. Now, one thing you may notice is that this picture is flipped around, because in this picture here we have the left eye, and over here we have the right eye, but the idea is still the same. Again, the color is a little different because of how the picture was captured, but we have here the optic nerve. And then what I want you to notice in the center of the macula, again, something different. Something about this patient looks different. I'm going to focus within the center on this kidney bean shaped area right here. And here we see this yellow area represents atrophy, or death of retinal cells. So we've gone from drusen, which are those yellow pebbles, to atrophy, loss of retinal tissue, and I'm going to put an X where the center of the retina is. So this patient is using the area of the X to see, but right next to the area that the patient is using to see is an area of atrophy. So this patient would have kind of a gray or black or blind spot adjacent to the center of the vision. Unfortunately, if this area of atrophy were to grow, let's say for example it grows in this direction right towards that X, then the patient will lose their center vision. So this is more advanced dry AMD. Some people also call this atrophic AMD. Next, I'm going to show you wet AMD. Okay, so as promised, here we have a photograph of a patient with wet AMD. And again, unfortunately, here you see the center of the macula, a large hemorrhage. In fact, this hemorrhage even goes outside the macula. And I'll just trace this hemorrhage here with my pen here. So here we have a large clot of blood, and unfortunately, this X is where this patient's central vision is located. So as you can see, this hemorrhage involves the patient's central retina and involves the patient's central vision. So this patient with wet AMD is going to have a large blind spot in the center of the vision, and again adjacent to the center of the vision, due to this blood clot. And again, this blood clot comes from blood vessels growing underneath the retina like weeds growing in your grass. So hopefully now you've had a chance to see a picture of a normal retina, a picture of a retina with drusen, a picture of a retina with atrophy, and here a picture of a retina with blood, that is a retina with wet AMD. See you in the next video.